So, Dr. Roche, what are some of the recommendations that you have and that you advise your clients of in order to preserve their skin?
Well, I think one of the best things to preserve skin is to wear a sunscreen every day. The sun, the UV rays are the biggest culprits of breaking down collagen. And it's all about keeping our collagen fresh, new, tight. So the UVA rays, there are two types. One are the UVB rays, and they're out during a bright day. We're aware of them. And those are the ones that brown us or burn us. There are also UVA rays, and the UVA rays I consider the aging rays. Those are the ones that are going to make you really old. So they are out even on a cloudy day. They penetrate through the clouds, they penetrate through glass, and they go deeper. They go deeper into the dermis, and they break up your collagen. And collagen is a very important structure in our skin. It provides the scaffolding to make our skin tight, youthful, less wrinkles, less sagging. So it's really important to use a broad spectrum sunscreen every day, covering UVB and UVA rays. I'm inside the office, all the time. I put it on. So that's the number one anti-aging practice that you can incorporate.
And is that the main thing in terms of proper sunscreen usage? Is just to use it every day, or is there more to it than that?
Yeah, well, use it every day. Put it on. It should be at least an SPF of 30. If you're going to be outside and active, then you need to reapply it every 2 hours. And depending if you're playing sports or if you're in the water, you'll need to reapply it more frequently. But, especially like for women, you put make sure you put your sunscreen on, you wash your face, you apply your moisturizer, then put your sunscreen and then makeup. And I know it's kind of hard to reapply that sunscreen again over your makeup, but there are many different types. There are mineral makeups that are in a powder form. You can just give yourself a sprinkle. But if you're really concerned about preserving your skin, start early and use sunscreen every day.
What else do you recommend in terms of a daily skincare routine?
So I like to keep the skincare routines simple but consistent. If you make things too complicated, you're not going to stick to your routine. So I have a morning and an evening routine. In the morning, as I just said, cleanse, moisturizer, sunscreen, makeup. In the evening, you want to wash off all of the pollutants, the makeup, everything you've accumulated throughout the day. So good cleanser. Then I use the evening time to treat my skin. When you're resting, your skin can absorb things better. So I use my antioxidants and treatments that are going to make a big difference in my skin. Good antioxidants are vitamin C, vitamin E, vitamin A. They help fight the free radicals that occur in the skin.
And what are free radicals?
That's a great question. A lot of people use the term free radicals, free radicals. So what free radicals are, our body is, natural metabolism of our body, whether we're breathing, digesting, it creates these cells that have been used. So they're free radicals and they are missing an electron. So these free radicals go and they start attacking other cells and they want to steal those electrons and make these healthy cells now damaged. So if we that process is actually called oxidation. So if you use antioxidants, that prevents that from happening. And it has been shown that the best antioxidants are vitamin C, vitamin E, and vitamin A. And that's they work in conjunction a little bit differently. Vitamin C and vitamin E are very giving molecules, so they will actually give up their electron to prevent these free radicals from attacking your cells. And vitamin A, such as retin A, retinoids, all of those retinols, they help on the other end. If there is damage that have occurred, then they will go in and help the cell turnover. They will kind of get rid of those damaged cells. So when you use a vitamin A, you may find your skin a little bit flaky, but that's a good thing. You're getting rid of the dead, dry skin cells and you're encouraging new cell turnover.
What are some other lifestyle practices that you recommend to promote healthy skin?
So it's not only what we put on or what we do, it's also certain things that you should avoid. And as I said, the sun. big culprit. But there are other things that you want to avoid. Smoking is a very big ager of the skin. Smoking, alcohol, and sugar consumption. So, smoking will cut down the circulation of your skin. And when you cut down the circulation in these little capillaries, you're cutting off nutrients, you're cutting off oxygen. Smoking causes uh, the skin to look dull. It makes it look yellow sometimes. It exacerbates the sun damage that can occur. It can also lead to skin damage such as cancers and such. The repetitive movement of smoking, the pursing of the lips, can cause wrinkles around the mouth. Um, so that's one of the big culprits of it just breaks down collagen and elastin, and we just talked about how important that is to build that up. So that's it just goes in and breaks that down. The other one, alcohol. Alcohol dehydrates you. And when you have dehydration, it's a diuretic, it's a known diuretic. And when you have dehydration in your skin, you look dull and like just dried, and the skin doesn't look plump and youthful. It also increases androgen production, and androgens are what create sebum or oil, and that can lead to blackheads, whiteheads, acne. So it's really important to avoid alcohol if you're prone to breaking out. And it causes inflammation. And sugar is a big one that causes inflammation too. The inflammation causes redness. It just, you look puffy, it looks red. So these are all things that you should try to avoid in your diet or in your daily intake to have healthy skin.
In regard to alcohol, are we talking about just the overuse of alcohol, or really any alcohol that you drink?
Really, any alcohol. You go out and you have just a couple of drinks one night, and the next day you may find that your skin doesn't look as good, look as vibrant. And it also can cause sleep disturbance. And if you have sleep disturbance, that causes stress, and you just don't look as healthy as you would. Everyone, I'm sure, is going to, not everyone, but people drink now and then, but of course, more alcohol is going to cause more damage. But if you can limit that, that would be ideal.
So you've talked a little bit about some of the things that you need to avoid. What are some of the things that maybe you should add to your regular routine in order to promote healthy skin?
Sure, yeah. Some things that you should eat, actually, a healthy diet. You can eat your antioxidants as well as put them on your face. So, some foods that have antioxidants are foods rich in vitamin C, citrus fruits, the berries, blueberries, strawberries, vitamin E. Foods that have rich in vitamin E are like avocados and nuts, omega. And another is green tea, which contains polyphenol, which is a naturally occurring plant based antioxidant and anti inflammatory. So, taking a lot of green tea. Hydration. It's really important to drink, 8 glasses of water a day. That is just going to make your skin look plump and youthful. The skin cells have a lot of water in them, and you want to keep them very well hydrated. And then other things to do are to get exercise every day. It increases your circulation of the skin, brings nutrients and oxygen. It helps you sleep better, so that helps reduce stress. So just these healthy, common sense lifestyle changes or lifestyle habits make a big difference in the complexion and your appearance.
When do you recommend starting all of these healthy skin habits? Is this something that you kind of wait until you're a little bit older as we age, or is this something that people should be starting really young?
Yeah, I tell people the sooner you can start it, the better. So start putting sunscreen even on your children, but start these habits in your 20s, and you'll age better, both your skin, your body, your mind. But it's never too late to start. So if you're starting in your 30s, 40s, 50s, even like 60, 70, the more you do these things, the better your skin and appearance, and you'll just feel better overall. So it's always a good time to start.